The Blackfeet tribe is planning to declare a public health state of emergency after learning several tribal members may have been victimized in a massive Medicaid fraud scheme in Arizona. The state's attorney general is now calling it one of the biggest scandals in Arizona history, claiming financial impact may stretch into the hundreds of millions of dollars. The scam left countless Native Americans homeless on the streets of Phoenix. Missing persons posters like these now litter the city, and some of those missing are from Montana, members of the Blackfeet and Crow tribes. According to Arizona state officials, unlicensed sober living homes lured hundreds of Native Americans to the state, where they were provided free housing with the promise of recovery. Those fake providers then allegedly billed patients for services not provided while collecting millions in Medicaid payments from the state. One of the alleged victims is Josh Racine, a Blackfeet tribal member who went missing after a non-licensed home he was at suddenly shut down. Racine ended up homeless and missing for about a month until his family was able to drive to Phoenix and find him to bring him back home to Montana.
So I asked the Phoenix PD, how would I find somebody if they're in a hospital and they don't have identification, because we knew that my brother didn't have any identification on him, or if he was deceased. And so they said that they would hold his body for 14 days. And after 14 days, they bury the unidentified in a pauper's grave in the county marked by a number, which was just so frightening.
According to a Phoenix-based grassroots organization called Stolen Persons, Stolen Benefits, it has helped locate at least 40 tribal members from the Blackfeet and Crow reservations and return them home to Montana. And the group says there are likely hundreds more from Montana who were victimized. The Navajo Nation also recently issued a public health state of emergency to get its people home safely. Several members of Montana's congressional delegation are reacting, including Senator John Tester, who sent a letter to the Centers for Medicare and Medicaid Services calling on the agency to investigate. In it, Tester writes, quote, "I am especially alarmed by the recent development that these fraudulent activities have reached tribal members in Montana who are seeking treatment. By offering promises of treatment in exchange for changing their residency to Arizona, these fraudulent centers have reportedly recruited Montanans and left them without care and stranded in Arizona."